Bladder 1 is located 1 fen medial and superior to the inner canthus of the eye. If a person scrunches up their eyes, a nice depression forms here, and that's where you're going to find bladder 1. Bladder 2 is located in a depression at the medial aspect of the eyebrow. Palpate along the supraorbital margin until you locate a nice dip at the medial end of the eyebrow. That's your bladder 2. Bladder 3 is located directly superior to bladder 2, half a sun into the anterior hairline, which means it's on the same level as Do24. Bladder 3. Bladder 4 is located half a sun into the anterior hairline, 1/3 of the distance from Do24 to stomach 8. Bladder 4. Bladder 5 lays half a sun posterior to bladder 4, which means it's 1 sun into the anterior hairline. This makes it on a level with Do23. Bladder 6 is 2.5 sun into the anterior hairline, 1.5 sun lateral to the anterior midline. Bladder 7 is located in relation to the midpoint between the glabella and the base of the occiput. It's 1.5 sun lateral to the midline at this level. To get your 1.5 sun, take the distance from the anterior midline to stomach 8, which is 4.5 sun, and divide this into 3. This will give you your 1.5 sun. Bladder 8 is located 5.5 sun into the anterior hairline, 1.5 sun lateral to the midline. The easiest way to find bladder 8 is to find bladder 7 and then move posteriorly by 1.5 sun. Bladder 9 is located 1.3 sun lateral to Do17. Remember that it's 4.5 sun from the posterior midline to the mastoid process, and use this to help work out your 1.3 sun to find bladder 9. Bladder 10 is located 1.3 sun lateral to Do15. It's 4.5 sun from Do15 to the mastoid process. So divide this area into 3 and just come a little closer to the posterior midline. You'll be on the lateral edge of the trapezius muscle.
Bladder 11 is 1.5 sun lateral to the posterior midline, below the spinous process of T1. Going to find the inferior border of T1 and come directly lateral to it on the height of the paraspinal muscle. Bladder 27 is level with the first sacral foramen, 1.5 cm lateral to the posterior midline. Bladder 28 is level with the second sacral foramen, 1.5 cm lateral to the posterior midline. If you palpate around the iliac crest until you fall into a depression inferior to the PSIS. Bladder 29 is level with the third sacral foramen, 1, 2, 3, 1.5 cm lateral to the posterior midline. Bladder 30 is level with the fourth sacral foramen, 1.5 cm lateral to the posterior midline. Bladder 31 is within the first sacral foramen. Bladder 32 is within the second sacral foramen. Bladder 33 within the third sacral foramen, and bladder 34 within the fourth sacral foramen. Bladder 35 is 0.5 cm lateral to do2.
Bladder 36 is located on the posterior median line of the leg in the transverse gluteal fold. Find bladder 40, travel up the posterior median line of the leg and find a depression in between the two hamstring muscles in the transverse gluteal fold. Bladder 37 is located 8 cm superior to bladder 40 on a line joining bladder 40 to bladder 36. There's 14 cm between these 2 points, so that means the bladder 37 is just over halfway. Bladder 38 is located 1 cm superior to bladder 39. It's on the medial border of biceps femoris, so it's not directly superior to bladder 39, but ever so slightly medial. Bladder 39 is located towards the lateral end of the popliteal crease, medial to the tendon of biceps femoris. To bring this tendon into relief, have the person take the weight of their leg. You should be able to feel a strong tendon at the lateral side of the popliteal crease. Put your finger on the depression that's medial to that tendon, relax the leg, and you've found bladder 39. Bladder 40 is located at the midpoint of the popliteal crease, in between the tendons biceps femoris and semitendinosus. To bring these tendons into relief, get the person to take the weight of their own leg. It then becomes quite easy to feel these two tendons. It's also easier to see where the popliteal crease lies. When they lower the leg, make sure you mark this point directly in the centre of the popliteal crease.
Bladder 41 to locate it, find the inferior border of T2 and come directly lateral to it, 3 cm lateral to the posterior midline. Bladder 54 is on the buttock, 3 cm lateral to the sacral hiatus. Typically, if you put your hands on the sides of the buttock, it is midway between the sides and the gluteal fold at the midline.
Bladder 55 is located 2 cm inferior to bladder 40 on the posterior midline of the leg, in between the 2 bellies of the gastrocnemius muscle. Bladder 56 is located on the posterior midline of the lower leg, 5 cm inferior to bladder 40 in the palpable cleft between the 2 heads of the gastrocnemius muscle. Bladder 57 is located on the posterior midline of the lower leg in a depression inferior to the 2 bellies of the gastrocnemius muscle. To find this depression, have the person point their foot. If you can't see the depression, palpate round, feel the bellies of the gastrocnemius and the Achilles tendon and spiral round until you can find a nice dip. This point is often described as being 8 cm superior to the lateral malleolus, that is, halfway up the length of the lower leg. It's not always there. Please go with the local anatomy to make sure you find this point correctly. Bladder 58 is 7 cm directly superior to bladder 60. It's often described as being 1 cm inferior and lateral to bladder 57, but that's not always the case. Bladder 59 is located 3 cm directly superior to bladder 60. Bladder 60 is located directly posterior to the prominence of the lateral malleolus. It lies in the deepest dip between the posterior border of the malleolus and the anterior border of the tendocalcaneus. Bladder 61 is located halfway between bladder 60 and the sole of the heel. Feel for a tender depression on the bone. Bladder 62 is located half a cm inferior to the inferior border of the lateral malleolus. It is located posterior to the peroneal tendons. To bring the peroneal tendons into relief, evert the foot. This is the peroneal tendon here. When the foot is relaxed, the point can then be marked behind it. Bladder 63 is located in a depression which is proximal to the base of the 5th metatarsal. Palpate posterior to the base of the metatarsal and you will find a nice dip that's just inferior to the lateral cuneiform bone. This makes the point slightly superior to bladder 64. Bladder 64 is located distal and inferior to the base of the 5th metatarsal. If you palpate along the lower part of the lateral border of the foot, you'll find a bump. This is the base of the 5th metatarsal. Locate this point just distal and inferior to the flare of the bone. Bladder 65 is located on the lateral aspect of the foot in a dip which is proximal and inferior to the head of the 5th metatarsal. It's the knuckle of the little toe. Move proximally and inferiorly and fall into a nice dip. Once again, be careful not to mark this point too much onto the sole of the foot. It's on the side of the foot. Bladder 66 is located distal and inferior to the 5th metatarsophalangeal joint. Find the joint, find the flare of the base of the proximal phalange and tuck your point up quite close to the bone. Be careful not to mark it too much on the sole of the foot. Bladder 67 is the lateral nail point of the little toe. Be sure to mark it clear of the nail bed.